What if the most important message your body ever sent you sounded like the most common complaint? A strange, persistent bloating, a little pressure in your belly, feelings we are so often taught to ignore, to push through, to label as just part of being a woman. The silent clues of ovarian cancer are hidden in patterns, not single events. And shockingly, over 70% of women are diagnosed too late because these patterns are missed. Pay close attention to symptom number 7. It's a hormonal clue most of us have never been told about. If you skip through this, you might miss the one signal your body is begging you to notice: belly whispers. Let's start with that feeling of bloating. It's not the kind you get after a big holiday dinner that's gone by morning. This is different. This is the bloating that decides to move in. Your clothes feel tight around the waist, even on days you've eaten light. There's a persistent, stretched, full feeling in your belly that just will not go away. It's there when you wake up, and it's there when you go to bed. You might blame it on stress, a new food you tried, or your cycle, but it lingers for weeks. This isn't just an inconvenience, it's a critical message. A 2023 study published in a leading gynecologic oncology journal confirmed what so many women have experienced. Persistent bloating or a visibly distended abdomen is the single most common symptom associated with ovarian cancer. Think of it this way: your abdomen is a tightly packed neighborhood of organs. When something new and unwelcome begins to grow, like a tumor on an ovary, or when fluid begins to accumulate because of irritation from cancer cells, the entire neighborhood feels the pressure. There's simply less room. That feeling of being stretched and bloated from the inside out is your body giving you a direct physical signal that the space in your abdomen is changing. So when you experience bloating that sticks around for more than 2 weeks and just feels different from your normal, it has earned the right to be investigated. It's more than a feeling, it's a physical clue. Now let's talk about pain. And just like the bloating, this isn't necessarily a dramatic, sharp, double you over kind of pain. More often, it's a vague, nagging ache that settles deep in your lower belly or your pelvis. It can feel like a dull, constant cramp, like something is gently pulling on your insides, or even an occasional sharp jab that comes and goes. Because it's often not severe, it's so incredibly easy to brush it off. We blame it on ovulation, an impending period, or a digestive issue, but when that ache lingers for weeks, when it becomes a familiar, unwelcome companion, it's telling you something important. As tumors grow, they can start to press on all their neighbors: your bladder, your bowel, your nerves. They can stretch the delicate lining of your abdomen, and all of this creates that persistent discomfort. And here is where paying attention to the pattern is everything. A landmark 2023 study in a major oncology journal revealed something that should make us all pause. For over 63% of women with early stage ovarian cancer, this kind of pelvic or abdominal pain was their very first noticeable symptom, often for weeks before their diagnosis. The clue isn't in the intensity, it's in the persistence. Doctors who specialize in this have developed a kind of rule of thumb. If the pain is new for you, if it's happening more than 12 days out of the month, and if it just keeps coming back, you can no longer call it random. It's a pattern, and that pattern is a question that deserves an answer. It's one of the clearest whispers that you need to hear. And this feeling of internal pressure leads to another very subtle sign: feeling full after just a few bites of a meal. Have you ever been genuinely hungry, sat down to a meal you were looking forward to, and then found yourself feeling completely stuffed after eating less than half of what you normally would? This sensation, known as early satiety, is another critical clue from your abdomen. It's easy to think, oh, I guess I wasn't as hungry as I thought. But if it happens over and over again, something else is going on. There are two main reasons for this. First, as we've discussed, a growing tumor or a buildup of fluid in the abdomen can physically press against your stomach from the outside. This reduces your stomach's capacity, so it takes a lot less food to make it feel full. It's a simple plumbing and space issue. But there's another layer. The cancer itself can release substances that interfere with the hormones that regulate your appetite, sending a "you're full" signal to your brain long before you actually are. Researchers writing in the Indonesian Journal of Cancer in 2024 confirmed that this feeling of getting full too quickly, alongside bloating and general abdominal discomfort, was one of the most common complaints women had in the time leading up to their diagnosis. It's part of a classic trio of symptoms that are so often overlooked because they seem like simple digestive complaints. When these symptoms show up together, the bloating, the discomfort, and feeling full too fast, they are no longer separate minor issues. They are a powerful, connected story that your body is trying to tell you. And that same theme of internal pressure explains our next symptom, which involves the bladder. You might find yourself needing to urinate much more frequently than usual. It's that annoying, urgent feeling of, I have to go now, even if you just went an hour ago. Again, the list of common excuses is long. You've been drinking more water, you had too much coffee, maybe it's a mild UTI. But when this change appears suddenly and persists without a clear reason, it's another sign that the landscape of your pelvis is changing. Your ovaries are located right next to your bladder. They are next door neighbors. As a tumor on an ovary grows, it begins to crowd the bladder, putting pressure on it and reducing the amount of urine it can comfortably hold. Your bladder feels full and sends that time to go signal to your brain, even when it's not actually very full at all. This isn't just a theory, the evidence is powerful. A major study published in the Journal of the American Medical Association compared women with ovarian cancer to women who were visiting their primary care doctors for other reasons. The results were stark. 55% of the women with ovarian cancer reported these kinds of urinary symptoms, frequency and urgency. In the control group, only 32% did. That is a significant difference that highlights just how important this symptom is. It's not the most obvious sign, but it's a reliable one. When your bathroom habits change dramatically and persistently without a good explanation, it's another piece of the puzzle. It's your body signaling that one organ is starting to interfere with the function of its neighbor. Body signals. Now let's move away from the abdomen and talk about a symptom that affects your entire being: fatigue. And I want to be very clear here. This is not the kind of tiredness you feel after a busy week or a poor night's sleep. This is a profound, deep in your bones exhaustion that rest doesn't seem to touch. It's the feeling of being completely wiped out, even after you've had a full 8 hours of sleep. For many women, this relentless fatigue isn't just a side effect of a busy life. It's a core symptom that shows up long before their diagnosis. Cancer is incredibly demanding on the body. It consumes energy and nutrients to fuel its own growth, essentially stealing resources from your healthy tissues. This process can trigger an inflammatory response throughout your body that contributes to that feeling of overwhelming tiredness and malaise. Recent research from the Oncology Nursing Forum gave us a fascinating look into this. They studied women undergoing treatment and identified distinct patterns of fatigue. Over half of the women experienced very high levels of fatigue, not just at the end of the day, but in the morning too. This deep tiredness was present around the clock, and this exhaustion wasn't just physical, it had a domino effect, impacting their sleep quality, their ability to concentrate, what many describe as brain fog, and their overall mood, often increasing feelings of anxiety and depression. It's a full body shutdown. When you feel unusually drained for weeks on end, when your energy levels have fallen off a cliff without a clear reason, it is a significant signal. It might be one of the first ways your body tells you that it is fighting a major hidden battle. This next symptom is deeply personal and one that so many women are reluctant to talk about, even with their doctors. It's pain during intimacy. So many women are told or tell themselves that this is just a normal part of hormonal changes or aging. But if intercourse begins to feel physically painful, not just uncomfortable, but a deep, sharp ache inside your pelvis, that is something that absolutely must not be ignored. There is a very real physical reason why this happens. As a tumor grows on or near an ovary, it can press on the surrounding tissues, nerves, and even the uterus itself. This creates pressure, inflammation, and tenderness in the very areas that are involved in sexual activity. The act of intercourse can put pressure on that tender area, causing that distinct, deep pain. Tragically, because it's such a sensitive topic and so easily dismissed, it's one of the most overlooked early warning signs. A 2021 study in the journal American Family Physician highlighted this exact issue. They found that pain during sex was significantly more frequent in women who were eventually diagnosed with early stage ovarian cancer, and it was often present for months before the diagnosis was made. The study heartbreakingly pointed out that the delays in recognizing and acting on this symptom led directly to missed opportunities for catching the cancer early. Your body knows the difference between normal discomfort and a new concerning pain. If intimacy has begun to feel physically wrong in a way that is new for you, please listen to that feeling. It's an incredibly important clue that deserves to be heard. And that brings us to the symptom I mentioned at the very beginning, the one that connects directly to your hormones and that so many of us misunderstand. I'm talking about menstrual irregularities. For many women, an unpredictable cycle is just a part of life. But we need to pay closer attention to the pattern of those irregularities. Are your periods suddenly arriving much closer together? Are they lasting longer? Or are they accompanied by unusually heavy bleeding that is new for you? These kinds of significant persistent changes could be your body signaling a deeper hormonal imbalance. And we now know that this imbalance could be linked to your risk. For a long time, it was thought that having fewer periods over a lifetime might actually lower the risk of ovarian cancer. But a massive landmark study published in the International Journal of Cancer completely changed our understanding. They followed over 15,000 women for 5 decades. 5 decades. The findings were nothing short of striking. They found that women who had a history of irregular menstrual cycles had a twofold, a 100% increase in their risk of developing ovarian cancer by age 70, and that risk nearly tripled by the time they reached age 77. This research suggests it's not the act of ovulating that's the only factor, it's the underlying hormonal environment. The kind of hormonal imbalance that causes those persistent irregular cycles could be the very thing that contributes to the development of the cancer down the road. This doesn't mean every irregular period is a sign of cancer, not at all. But it does mean that we must take our menstrual health seriously. It's a direct window into our hormonal health. And if that window is showing you a picture of chaos, it's a sign that you need to find out why. Digestive disguise. Now, we're going to talk about a set of symptoms that are the ultimate masters of disguise because they look exactly like common stomach problems. Let's start with indigestion or heartburn. That burning sensation in your chest after you eat, that bloated, gassy feeling that just makes you uncomfortable. Most of us immediately reach for an antacid and blame it on the pizza we had for dinner or a stressful day at work. But when that indigestion or heartburn becomes a regular, almost daily part of your life, it's time to think differently. In some cases, these seemingly harmless digestive issues are actually early clues of ovarian cancer. It sounds surprising, but the research is very clear on this. A major UK trial on ovarian cancer screening gave us a crucial piece of this puzzle. They found that gastrointestinal symptoms, including indigestion and heartburn, were reported by 35% of women with a very specific and aggressive type of early stage ovarian cancer. And here is the part that will stop you in your tracks. These digestive symptoms were actually more prevalent and were reported more often than the more traditionally recognized gynecological sign of abnormal bleeding. Let that sink in for a moment. The clues were showing up in the stomach, not where you would expect them to. This is so important because it means we need to expand our idea of what a women's health issue looks like. It's not always confined to the reproductive system. The study powerfully emphasized how important it is not to dismiss these persistent digestive issues, especially in postmenopausal women. If you're constantly battling heartburn that doesn't respond to the usual treatments, it might not be your stomach that's trying to talk to you. And that leads to the next very visible sign of abdominal trouble, a swollen abdomen filled with fluid. You might notice your belly slowly but surely getting bigger. And yet, the number on the scale isn't really changing, or you might even be losing weight elsewhere. Your pants start to feel tight, not because of fat, but because your waistline is expanding. This isn't normal bloating, this is a buildup of fluid, a condition called ascites. It happens when cancer cells spread to the peritoneum, the delicate lining of your abdomen, and irritate it. Your body's natural reaction to this irritation is to leak fluid into the abdominal space, the area around your organs. It's like a slow internal leak. This can be more than just uncomfortable. As the fluid builds up, it can make it hard to take a deep breath, difficult to eat because of the pressure, and even difficult to move around comfortably. Doctors view the presence of this fluid as a very significant warning sign. A 2015 study in the highly respected journal Nature Reviews Cancer noted that many women with newly diagnosed ovarian cancer already have a moderate to severe amount of this fluid present. The study found that the presence of ascites was directly linked to a more advanced stage of the disease and sadly, to poorer outcomes. It is a physical, measurable red flag that doctors look for on ultrasounds and other scans. So, if you are struggling with this kind of unexplained, persistent abdominal swelling, especially if it seems to go down and then come back again, it's absolutely worth asking your doctor for further testing. It is one of the clearest ways your body can try to show you that something serious is happening inside. Our next symptom is another that masquerades as a simple stomach bug: nausea and vomiting. Feeling queasy, an aversion to food, or even episodes of vomiting. These are things we almost always connect to something we ate or a viral infection. But when nausea and vomiting linger for days on end or keep coming back without any clear reason, they deserve a closer look. The reason this can happen with ovarian cancer is, once again, about physical pressure. As ovarian tumors grow larger, they can begin to press against your stomach or your intestines. This can slow down the normal process of digestion, or in more advanced stages, it can even cause a partial or full blockage of the bowel. This physical traffic jam is what can trigger that chronic nausea and sudden unexplained vomiting. A 2022 study published in Gynecologic Oncology gives us a clear picture of this. They followed over 1,100 ovarian cancer patients and found that nearly 36% of them, more than 1 in 3, reported experiencing nausea or vomiting during the time they were trying to get a diagnosis. And a huge problem was that these symptoms were almost always misattributed by both the women and sometimes their doctors to common GI issues. What's even more concerning is that this led many of these women to delay seeking the right kind of help because they thought it was a dietary problem or just stress. The study emphasized how critical awareness of this symptom is because every day of delay matters. So, if nausea becomes your new unwanted companion and there's no obvious cause, don't just keep hoping it will go away. And the final symptom in this category is perhaps the most surprising of all: pain in your legs or thighs. This is not typically the first thing anyone thinks of when they hear the words ovarian cancer. It's far more likely to be blamed on a pulled muscle or sciatica from a back problem. The pain usually presents as a deep, persistent ache or a cramping sensation, and sometimes it feels like it's radiating from deep inside your pelvis down into your thighs. The reason for this strange referred pain is again about pressure. A growing ovarian tumor can press directly on the major nerves, like the obturator nerve, and the blood vessels that run through your pelvis and down into your legs. This pressure can disrupt circulation and irritate those nerves, leading to that persistent leg pain that has no obvious cause in the leg itself. A case study published in 2024 in the American Journal of Case Reports brought this issue to life in a stunning way. It detailed the story of a 31-year-old woman who had been experiencing increasing low back and right leg pain for 2 full years. 2 years. She was treated for all sorts of musculoskeletal issues and nerve problems with no success. Finally, after all that time, she was diagnosed with a very large ovarian tumor that was growing in the exact region of her pelvis that was causing the nerve compression. After the tumor was surgically removed, her leg and back pain completely vanished. This case is a powerful reminder of how ovarian cancer can mimic completely unrelated problems and why persistent leg pain without a clear local cause should always make us think bigger. Final clues. And our last sign is another that's deeply personal: unusual vaginal discharge. It's easy to overlook small changes, but when that discharge becomes different for you, if it's persistent, watery, bloody, or has a foul odor, it could be your body signaling a problem. While this is not the most common symptom of the most common type of ovarian cancer, for certain rarer types like stromal or germ cell tumors, it can be a significant clue. These types of tumors can sometimes produce their own hormones or disrupt the surrounding tissues in a way that leads to these abnormal secretions. The Centers for Disease Control and Prevention have highlighted this connection, noting cases where women with early stage ovarian cancer reported a persistent, unusual vaginal discharge as their only noticeable symptom. This just underscores how important it is to be attuned to even the most subtle changes in your own body's normal patterns. If you notice any kind of discharge that doesn't seem right for you and doesn't resolve, it's worthy of a conversation. It's one more piece of the complex puzzle. This isn't about creating fear, it's about ending silence. It's about empowering you with the knowledge to listen to your body with wisdom and compassion, not anxiety. A single symptom on its own might mean nothing but a pattern of symptoms, a collection of whispers that together start to form a steady voice. That is something you should never, ever ignore. You are the world's leading expert on your own body. You know what feels normal, and you know when something has changed. Your body is your oldest friend and your most loyal advocate. All it asks is that you learn its language and have the courage to listen when it speaks.